Good morning, everyone. Today is Monday, November 3rd, 2025, and we are here this morning meeting as the Board of Social Services. I'm Kristen Stevens, Chair of the Board of County Commissioners, and I guess Chair of the Board of Social Services. And with me are my fellow commissioners, Commissioner Jody Shattuck McNally, Commissioner John Kafalis. Our county manager is with us this morning, Lorinda Volker, and I will turn things over to Heather O'Hare, our Human Services Director. We have a lot of people in the room, and we'll let folks introduce themselves as they speak, but welcome everyone, and we're happy to hear the information you're going to provide us this morning. Thank you.
Thank you, Commissioner. Good morning. Again, Heather O'Hare, Human Services Director. And if it's okay with you, I might do quick introductions just because it is going to be mostly dialogue, so it'll be easier and more efficient. And we will start with Nancy.
Hi, I'm Nancy Kelly. I am a Deputy Division Manager with Benefits and Community Support Division.
Good morning, Vanessa Fuel, Division Manager with Benefits and Community Support Division.
Morning, Thad Paul, Division Manager, Child, Youth, and Family.
Good morning, Hannah Ditzenberger, Policy Analyst with the Department.
Good morning, Jill Mosh, Division Manager for Operations and Organizational Development and Human Services.
Good morning, Lori Metz, Division Manager for Aging and Adult Services.
Okay, so we are going to, we have a quick presentation this morning on an exciting update partnership for our TANF program that we wanted to make sure you were all aware of. And then we're really going to spend the bulk of the time coming back to federal updates. We had a work session on October 8th that we know we presented you all with a lot of information. And so we wanted to bring back new information that we have since that time, but also just see what additional questions or detail you all would like, in addition to updates on the federal shutdown. So the majority of the agenda today is intended for the federal updates. Any additional items that you all would like?
Go ahead, Commissioner Kafalis.
I don't think I saw this in the slide presentation, but I would like to have more details about what's happening with our community partners on the ground to address our current circumstances.
Yes, we will definitely cover that.
That's great. Anything, Commissioner Shattuck McNally? No, I think that will cover it then. Thank you.
Okay, so we will start with Nancy and Vanessa to share about our Vroom Mathematica study.
Good morning. So Nancy, is it on? Yes, okay. So Nancy will cover the majority of this. I just wanted to share kind of an overview. So Vroom is a resource, created by the Bezos Family Foundation, which seeks to bring the science behind early childhood development to parents and caregivers through tips that they can use in their everyday life. And I just wanted to share that when we introduced this to our team, because I also have young children, I have used it with my kids. So really anyone can use this. It's not solely, made for the TANF population. It's really for anyone. But as we thought about how it could be applied as a point of connection for our case managers with clients to be able to offer them a parenting resource in addition to the other variety of case management services that we offer. Our partnership with Mathematica, who also helps, and Nancy will talk a little more about that, has been quite successful, and they've asked our team to come and present with them at conferences, et cetera. So it's been quite a success, and I think it's a pretty neat product that, again, is available for anyone. And with that, I'll turn over to Nancy.
All right. Hopefully everybody can hear me okay. So like Vanessa said, Vroom is a parenting app, and so it can be accessed either through a phone app or on a website, or for people who speak languages outside of English or Spanish. They can also have tips texted to them on a weekly basis that are in their language of origin, and it really is meant to kind of help parents and children interact in ways that are healthy and are designed to kind of build brain power. So the science shows that in the first 5 years of life is when the brain develops the fastest. And we kind of see that as we are interacting with children, everything is new and it's wonderful and they are curious. So Vroom targets families with children aged 0 to 5. And it's entirely free. So this is a resource that can be used for parents and caregivers. I know my daughter-in-law uses it with the little girl that she nannies for. And it's just a way of turning everyday moments into something that helps the parent and the child interact in a way that is healthy and builds curiosity and resilience in the child. Can we switch over to the app? So this is what the website looks like. And let me get back onto the page. So I created 2 children on the website just so that we could kind of tour a little bit what it looks like. So Sunshine is what I used to call my daughter when she was little. So Sunshine is this particular child, and on the app, Sunshine is 4 years old. And so this is an example of a tip, and really just kind of looking at talking to your child about feelings and helping them learn how to manage their emotions. So the tip is to kind of talk to them about a time when you were sad or tired or scared or excited, and kind of going back and forth with what those feelings look like as a way of helping the child learn how to explain their feelings and understand what they're feeling. If we can switch over on the top to Dude, which is what I called my son when he was little. And so Dude is 1 on this app. And so we whisper and we talk really quietly. And it teaches children how to really be able to listen. And so this is something that you can do at an appointment. It's something that you can do in the car. So these tips are really designed to do kind of during everyday life as a way of teaching children things that help them, especially when they become school age and have to learn how to pay attention and how to moderate their voice. Anybody who is a parent has used the term, let's use our inside voice. This is a way of also using our very quiet voice. So if we can go back to the slides. And so we partnered with Bezos Family Foundation. Thank you. No, this is perfect. We partnered with Bezos Family Foundation, which operates Vroom, and with Mathematica, who did a lot of the research project. And one of the reasons that they wanted to engage with Colorado Works was twofold. One was to see if there was impact on introducing the product Vroom to families, and TANF has a lot of families with young children. So it seemed like a natural population. We also serve, sorry, I lost my train of thought there for a second. So because TANF serves families throughout Larimer County, our goal is to not only create economic stability for our families, but really also to work on family well-being. So we view TANF program as an entire family program and not just for the adults who are in the household. Because there are a large number of families with young children in the household, it really kind of created an opportunity to see whether there was greater usage of this through introducing it through TANF, and also from the TANF perspective to see if it created better engagement on the TANF end. So TANF, for people who may be listening and aren't super familiar, is temporary assistance to needy families. In Colorado, we call that the Colorado Works program. And part of Colorado Works is the requirement to engage in certain barrier reduction activities with the goal of the family moving forward in achieving not only family well-being, but economic stability. Okay, next slide. We introduced Vroom in 2 separate ways. The first was a coach-led introduction where the TANF coach or the Colorado Works case manager introduced the participant to Vroom at either their first or their second meeting with their coach and asked them to create an action step on their individualized plan. We use a platform called My Journey to Success, which is through Tuapath, and that involves learning a little bit more about Vroom, and then if they want to use it, they can sign up and create an account for themselves. For our control group, we just gave them information about Vroom along with other community resources. So it wasn't a specific introduction. We didn't show them the action step and didn't really try and engage them in Vroom. So we were able to create an action step, which is kind of a piece of the individualized plan in our platform, which again is called My Journey to Success. And it invites the parent to read the description, watch a short video on the benefits of Vroom, and then if they wanted to, they could just click a button and that added it into their individualized plan. So this is kind of under family well-being. It's not specifically targeted to resolve a barrier necessarily, but again, from that two-generational approach to look at the well-being of the entire family. So what we found is that through focus groups, we did focus groups with both the informational group and the coach-led group. We found that participants reported that learning about Vroom improved their TANF experience. So people really felt that there was a positive impact on the engagement with the Colorado Works program. Participants in the action group were more likely to say that learning about Vroom improved their experience overall with TANF, and they also had modestly higher rates of attending a subsequent case management session with their coach. There are a variety of reasons why our TANF participants might miss an appointment. Sometimes it's illness, sometimes they forget. So a variety of reasons. And then, of course, if they are no longer engaging with the TANF program, then they'll go off of TANF entirely and not work with their coach. So we did see that there was some success in the participant end on terms of their engagement with TANF. Some of the impacts on our coaching staff, so I've got some quotes from our coaches with their experience in using Vroom and working with their families. So Vroom can build trust with parents. It shifts the tone of these meetings from compliance, because they are mandatory, to collaboration. Vroom creates an opportunity for positive interactions and a feeling of genuine interest in the family's well-being as a whole. It also invites storytelling. The parents share how they tried a Vroom activity, and it opens the door for authentic conversation, which again continues to build trust, and it really helps our families in terms of resolving those barriers and moving themselves forward. It normalizes the coaching conversations. They see our coaches more as allies and as part of their process, and not as people who are judging them. And again, it supports that whole family engagement and two-generation outcomes. We're integrating the child's development into our TANF self-sufficiency mission. And then, so some of you are familiar with the TANF Leaver Survey. This is done through Public Consulting Group, and they do this both quarterly and annually. And one of the things that we see is that Colorado Works helped my children. Larimer County is at 96% and the state is at 88%. So we've seen a huge increase in our engagement with our parents and in parents feeling in Larimer County that TANF is a program that really does benefit their children, because we are approaching it from that perspective that TANF supports the entire family, again, and not just the participant. And that's all I've got.
Thank you, Nancy. Any questions for Nancy about the Vroom program? Works. Go ahead, Commissioner Cavallis.
Two questions. I think they're simple. One is, how long have we been using this Vroom program? And my second question is, when it gives those tips, are they like daily tips, or how does 365 days a week you get these daily tips? And those are my questions. Thank you.
So your first question in terms of how long we have been using Vroom, some of the coaches have been using Vroom for quite some time and have been introducing that. We did specifically tailor the pilot to ensure that we were following appropriate research protocols during that time. We continue to introduce it. The study itself ran from, I want to say, late fall of 2023 into the summer of 2024. And then we are getting the research results kind of now. In terms of tips, so anybody who uses the app or the website can get a daily tip, and they just log in as often as they want. For people who want to have tips texted to them, Vroom will text them tips on a weekly basis, just so that they're not overwhelming people with a ton of texts on a daily basis. But those tips that are emailed on a weekly basis are multiple tips that they can utilize throughout the course of the week.
Commissioner Shannon McNally?
So thank you for, this is really interesting and thought-provoking. And it certainly has some bright spots here that, so my question is this ongoing? Is the Bezos family, who's paying for keeping this going? And you know, if this is showing good results, is it going to be used further in other areas? And what's the future? I hate to have kind of ones and dones, especially if they had these families who had a positive experience. And then is there studies to see, maybe I'm taking it too far, but if these kids are in school, does this help with kids doing well in school? And what other kind of things could we use this to help track that this might be a really good intervention? Common sense from me, as much as I did in the schools for 2 decades, we know if this is done early in the early years, it's really a good intervention, would help with learning and reading, and so I'm curious about that.
So there are a bunch of studies. Just because we are not doing the pilot anymore does not mean that we are not continuing to introduce Vroom. So the action step remains active in the action step library that our participants can choose from. Our coaches continue to introduce it to families with children of the appropriate age. And again, this is not limited to the pilot. Anybody can log into the website and create an account for themselves or their children. In terms of studies, there have been a number of studies, and a lot of them are available on the website that you can refer back to. I didn't include them because it's a lot of information and a lot of detail, but there is some positive research that indicates that children who are engaging in some of these activities tend to do better in school farther on, because some of this is also teaching them early critical thinking skills, and that obviously benefits children as they enter school age. So it would be lovely if we had something similar to this for children who were older, especially when we get into parenting those teen years. And right now, this is geared towards kiddos 0 to 5. I'm sure there are a ton of resources for teenagers, and we survive that somehow.
Thank you.
Well, thank you, Nancy. This is a great program. So did you say this is available, to anyone? Like, this is a resource that?
Yes. So anybody can go to the website, which is vroom.org, and it is entirely free of charge.
That's great. I think this is a great resource. I wish I had something like this when I had young children, because, I mean, I think you can get in a rut or not know what to do, or be in a place where, what should I do with this child today, or what, how should I interact? And so I think having those tips is really good to sort of get you out of, maybe a routine that you're in, or to really, like you said, develop critical thinking skills is really important for that age group. So I think this is a great tool. Really interesting to see how it improved people, showing up to meetings even, right? Because, I mean, would it improve your relationship with your child? Yes. But would it improve, make you more engaged in the Colorado Works program? That is an interesting outcome from that. So,
Yeah.
so yeah, great. Thank you for sharing this with us. Did not know this, did not know about this resource, and I bet a lot of community members will be happy to know. And I like the idea that people could get those tips in their own language via text if they were not English or Spanish speakers. Is that primarily who?
Yes, I think they have about 15 other languages right
Oh,
now.
wow, that's incredible. Well, this is a great resource. Really happy to learn about it. Commissioner Kafalos.
Thank you, Madam Chair. Along those lines, in our public health department, is the nurse family partnership using this app, this program? If not, is that something we could encourage them to do? And then another targeted audience would be, I think there was some reference to grandparents, but the Grand Family Coalition, are they aware of it? Because I'm sure it would be beneficial to them. And I don't know if we have a version of this that would help caretakers who are taking care of older folks. Is there a version? So there are 3 questions in there, I'm sorry.
So we certainly can share, I don't know if our health department is using it, but we certainly can share it and share it out to, I think there are probably several different departments that this would be beneficial to. I was also thinking about the Early Childhood Council. I think there's a variety of community partners that could benefit from including this. In terms of something comparable for older adults, I don't know if there is. But it's a really interesting point.
There ought to be.
I agree there should
Would you
be.
tell the Bezo Family Foundation to work on that, please? Thank you.
But I think, so we've had a lot of conversation about the TANF program, and yes, that basic cash assistance is crucial, but it cannot be the only solution of the TANF program. And our TANF team, our Colorado Works team, under Nancy's leadership, and Josh, who's the manager of the team, continues to be highlighted as one of the models in Colorado. And we have really stripped a lot of the ancillary supports because of our budget constraints, and yet continue to seek out opportunities like this, and continue to build how we offer case management and how we try to support that TANF recipient in different ways. So really important as we continue to talk about the TANF program, and just continue to highlight these opportunities, and not only the free resources, but the academic research to also evaluate what we're doing, and continue to share that out across different counties for opportunities that other counties might look to.
Thank you. Commissioner Shattuck McNally.
Thank you. Another area I think I might be interested to introduce this, the Youth Mental Health Task Force is meeting. We met last week, and it was we had some folks from Colorado Department of Education come and talk about MTSS, multiple tier systems of support. Did I get that right? Which I know about, but it also looks very much like PBIS, positive behavior intervention support, and I did all that training way back. It wasn't that long ago. It feels like it was a century ago. But might be another thing to introduce, maybe because of some of those higher, more involved layers of support might be an interesting thing to share for families. So I just didn't know if that was something we could also reach out to. Dr. Jared Olson's and I are both on that, and Amy Martonis, the Director of Behavioral Health. So it might be another thing just to share, because I think that would also help the schools, since kids are there 80% of the time, and it might be another way to help get this shared. So I think this is really fascinating, and I think as we talk about older adults, it's, it's a very complex thing because we have dementia sets on and there's, sometimes they're not even aware, and it's probably hard to have folks understand maybe where they're at, since I currently experiencing that with my family. So I'm just curious about how that would work. But just let me know what you think, and I'm sure you all have those connections. But this was something we were talking about on Thursday last week. So thank you.
Thanks, Commissioner. Yeah, and we just touched on the Levers survey very briefly, but kudos to all of you who make that happen, because, I mean, we are so heads and tails above the rest of the state, even though we have, I would say, more financial challenges than many other counties do, and we continue to lose dollars because of the way those dollars are funded, that our numbers are, often 10% higher than the rest of the state. And so we are doing a lot with the money we have, and thank you, Nancy and team, because I think that's something that we should, we just talked about it briefly, but it's very impressive, the work that we do. All right, so I guess we're ready to move on to the topic du jour, which is federal updates.
Yes, so unfortunately not a whole lot of good news, but want to make sure that you all have the updates as we have them. So we are going to actually provide updates first on the government shutdown and where things stand as we are in, I believe, day 34 of the government shutdown. And then we'll transition and give you updates on the HR1 related changes that are coming and all of the planning that's happening there. Okay, so I'm actually going to hand it over to Hannah.
Wonderful. Yes, so the federal shutdown began on October 1st. The shutdown primarily affects programs that receive discretionary rather than mandatory funding. So certain mandatory programs, including Title IV-E, Medicaid, and CHIP Plus, and child support will not be directly impacted. And then TANF, Title IV-B, CCAP, and some county block funds reconcile every quarter in Colorado. And so as long as the shutdown doesn't exceed 3 months, then these programs will not be directly affected. And CDHS does not expect disruptions to area Agency on Aging services and programs. The federal shutdown began on October 1st, and 10 days later, the Food and Nutrition Services directed states to suspend all SNAP benefits for November. On October 22nd, the state notified SNAP recipients of the suspension of benefits. Last week on Thursday, so October 30th, the Joint Budget Committee approved $10 million to be distributed to food banks across the country throughout the month of November. Approximately $650,000 will be going to the Larimer County area. Cities, states, religious groups, and nonprofits sued the federal government, claiming the suspension of benefits is unlawful. On October 31st, 2 separate judges ruled that the suspension of benefits could be unlawful, and they ordered FNS to provide a plan to restore funding. That plan was supposed to be provided today, November 3rd, and we have yet to hear details of that plan. In Larimer County, 8,817 households received benefits in June through September of this year. But by the end of October, 2,500 households had 0 balance. The federal shutdown is also creating significant delays in states receiving the necessary guidance regarding HR1 provisions, which we'll talk more about later on in this presentation.
So a couple of additional details that we want to add. The $10 million that the Joint Budget Committee approved is $10 million in total, but it is planned for 3 different disbursements. So the first roughly early this week, and then another one targeted for November 15th, and another one for November 30th, if the shutdown extends and or the suspension of benefits goes on that long. So with the 2 separate rulings from the federal judges just on Friday, what we are hearing is that in the plan that Food and Nutritional Services, FNS, has to provide by today to the federal judge. The judge is ordering that benefits actually be released by this Wednesday. How quickly that means that SNAP recipients would actually have the benefits loaded on their card to be able to use, we're not sure. Or if the federal administration will appeal. So we should see a plan today, and hopefully benefits could be released as early as Wednesday, which then likely the Joint Budget Committee's $10 million would not go into effect. So the timing of how that happens, we'll keep you all updated. But we have been in touch with Amy Pisani from the Food Bank, and she is working on, so the funding will go through Food Bank of the Rockies, which then distributes it out to additional food partners across the state. And there's contracting logistics and all of that that Amy is working on, but she estimates that about $650,000 is what Larimer County would receive, and that then that can be stretched to 3 times that amount in purchasing food because of their purchasing power. So, 1.8 million, 1.7 million, roughly in the purchasing of food. But again, very short of the 6.5 million that goes out in SNAP benefits each month. So still a significant gap in the food resources. But if benefits are released this week, then the CBMS changes that the State Department will have to go through. There's a lot of sort of rewind that will have to happen, that they're already planning for and working for to see how quickly then those benefits can be out and distributed and available to use.
Commissioner Shannon McNally.
If it is released this week, which, I mean, I'm sure there will be some legal wrangling or whatever, it'll be a day or two before this kind of gets worked out, but also disruption into the system, I'm sure could cause some confusion or delays or some maybe unintentional gaps. Or I'm just wondering if, especially some people who just qualified last week, if there's any disruption. I'm wondering, and with all good intentions and everyone working really hard, there still could be some unintended consequences for folks getting lost or bumped or fall through the cracks. And I'm just wondering, is there a way for folks who have questions that they just call you directly, or what are your thoughts on that? Just because I'm wondering how we get ahead of this so we can help prepared for any. I'm almost feel like we've got to hope for the best and plan for all contingencies at this point. So I'm curious about that. Thank you.
So the notices went out, as Hannah said, on October 22nd. So we are already seeing a lot of questions and confusion about why they're not receiving benefits. And then there was another round of notices that went out for anyone that has applied for food assistance since the 22nd. So that is a different notice. But there is a lot of confusion and questions that we are sorting through, and that our phone teams and Vanessa's staff, Lori's staff, as they're working other programs, are helping people wade through the details of this. And we are continuing to operate as though benefits are going to be suspended without an end date until we hear many more details from the State Department of what it's going to look like to roll this all back. So I want to have Vanessa speak to a specific report that we are working from the State Department related to 2,500 households that had already exhausted all of their October benefits. So we call it the zero balance report. Those households we know had already spent their October benefits by the end of October. And so Vanessa's team has been working directly with them to help navigate resources.
Before you do that, I just, I noticed that, Hannah, that you had a slide before this slide, and I don't have that in our packet, so can we get that to us top of, I didn't know, maybe the one before this one? Yeah, that one we don't have, so if we could get that one. Or maybe it's just me, it could be, just,
Yeah, I don't have that one either. I took notes
So-
on it, but I don't.
okay, thank you. Sorry, but just trying to, because I'm trying to write furiously, but this would be great to have. Thank you. Sorry, thank you, Madam Chair.
So as Heather mentioned, we received the zero balance report from CDHS. This was a report where they were able to see, so food assistance benefits go on an EBT card, right, in a dollar amount. That's what you are determined eligible for, and then you use that money to go to the grocery store and buy food. So anyone whose balance is at zero means they have already gone and spent those dollars on food this month. We kind of simultaneously, as the state was working on pulling this report, we saw a pretty significant reduction in applications coming in the door. Likely because it gets out in the community that benefits aren't going to be issued in November, and so then people just don't apply. We are strongly encouraging everyone to continue to apply, continue to do their redeterminations, continue to submit any associated paperwork with, for their case to maintain their benefits. That said, when we see that slowing in benefits, then we find capacity in other areas. So what we do is, in this case, we started doing reverse outreach. We've got specialists calling households, providing specific food resources available, and we are hearing a lot of really positive response to, yes, I can find on Facebook whatever resources are being put out or other social media, right? There's lots of food lists, but having someone contact the household directly and say, we know that you have $0 on your EBT card. Here's where you can go get food today. And then also providing any additional information to them about what is happening with their case. Are you still eligible for the month of November? Do you have a redetermination coming up? Submit your paperwork. Are any of the changes from HR 1 going to impact your household? It's also giving us opportunity to do a little additional education with clients in hopes that we maintain people who are still eligible on the program. And of course, to your point about what are the gaps and who might be falling through the cracks, we want to catch anyone and everyone, assuming kind of that this is a high vulnerable population because they have that zero balance. They likely are a household that doesn't have other resources to purchase food with.
Other questions? Go ahead, Commissioner.
My first question is, well, that's great about this reverse outreach. That's really wonderful. I think it's also important to note, before I ask my couple of questions, that I think I read in the paper somewhere that the food bank for Larimer County received a $100,000 anonymous grant, and they were able to distribute funds to food pantries. And I guess related to that, what kind of outreach is happening with food pantries, because they're on the fringes. They're part of the distribution network to get the food out. I guess that's my first question, if you all want to respond to that. And I just have a couple more, if that's all right. The food pantry outreach and things like Kids Pack and, Rams Against Hunger and all that stuff. Thank
So
you.
there is it's sort of a network is the best way to explain it. It's called Feeding Colorado, that is very large food banks and then also very small food pantries, backpack programs. So food insecurity network across the state that has an association and connections with each other. And there is this structure to it that Food Bank of the Rockies is sort of the leader of Feeding Colorado, if you will. And so that's why the funding is going to them. And then there's a distribution process and a communication outreach process from there. For Larimer County, Food Bank for Larimer County is sort of the hub for our county that then takes that distribution of funds, the delivery of food, the communication and outreach then to local partners. So I don't want to speak directly for Amy and her team on what that looks like in logistics, but there is a structure in place and a network there. And the State Department of Human Services called many of them to the table for a focus group a couple of weeks ago to talk through, this was prior to actually requesting the $10 million, but to talk through potential solutions and challenges and questions, and then to also use a heat map of SNAP data from the state as a tool on how to focus on specific areas across the state and both in resources and communication and outreach. So there is a lot happening. And then I was just talking with Lorenda before this. If we don't see the resolution of SNAP benefits on Wednesday, then we will take additional steps to potentially pull our local partners together and facilitate more of a conversation to see what we might do collectively at the local level, as this would then go on much longer.
Thank you. My second question is regarding the number of households and individuals that are receiving food assistance, food aid. Is there a way to break out the 34,000 individuals? How many of those are children? How many of those are older adults? How many of those are people with disabilities? I think that would be helpful if that's easy to be done. And any other demographics that you all think are important. And if I may, related to that is, are we able to determine the economic impact of not using the EBT funds in our local grocery stores?
So your first question, yes, we do have the breakdown, and we can get it pretty quickly because I think it's on one of our future slides from our work session just a couple of weeks ago, but it is 50% at least that are children in Larimer County, but also across the state are receiving SNAP. 50% of the 34,000 that are receiving SNAP are children. But we do have the breakdown then of older adults as well as individuals with disabilities. In terms of the economic impact, so we know off the bat that there is almost $20 million every 3 months coming to Larimer County in the food assistance. How that then, the economic impact is much bigger as that's then spent in grocery stores and has a much broader reach in terms of dollars. But I don't know that we actually have data to that. We do have something similar on the Medicaid side, but we've never really been able to quantify the economic impact of the SNAP dollars themselves. But we know that it is $6.5 million each month that Larimer County residents are receiving in SNAP benefits, for a total of a little over 19.3 million just in the last quarter alone.
I think maybe one more.
Okay, sure.
So we've been reading about the lawsuits and the judge's orders, and I understood that if there was the issue of full payments versus partial payments. Full payments would begin today, partial payments on Wednesday. Could you explain that a little bit more? I have a feeling it has to do with computer systems, but why is that the case? And is there any, forgive me, but related to that, is there anything to what we've been reading about, that there's other discretionary funds besides the $5.6 billion that's in the contingency fund, for the SNAP? They've suggested there's another pot of money, $23 billion, that might help with, perhaps providing full payments for November and until we get our act together with the government shutdown.
So the full payment versus the partial payment is really a prorated methodology. So if benefits were to be issued on Wednesday, the partial payment is to prorate it from Wednesday through the end of November versus providing that household with their full monthly benefit amount that they would have expected without this disruption. And I think the detail of the federal lawsuits is that suspension of benefits at any level is unlawful, and that it should be a full payment, not prorated from when benefits are turned back on. So that is one of the details that we'll have to see how that plays out. Your second question, though, about there is contingency funds, and in one of the federal lawsuits, I don't recall which one, but the judge also remarked that there are, even outside of the contingency funds for this purpose, there are other activities that have been able to been sustained during the government shutdown that could be suspended, that would not be unlawful to suspend, and suggesting then that the funding that's being used to contribute towards those activities could be shifted. So moving funds between program areas and being able to leverage as much flexibility at the federal level to make that happen. So the contingency funds themselves is not enough to cover the month of November's SNAP benefits. But one of the federal judges did remark that there are other pots of money that is available and should be prioritized towards this.
And it appears that the feds can transfer those funds quickly, although I'm surprised to hear that, but relieved. But then there's the states. I mean, we work through a vendor. How quickly can CBMS or whoever is responsible for putting that money on the cards?
So it is a third-party vendor, and Vanessa may remember their name. EBT Edges, who we use. So it is a third-party vendor, which does create some delay. I think the other delay is that it is the same third-party vendor for 40 other states. So there is likely a bottleneck of how this would happen, knowing that that same vendor is trying to do the same thing for 40 other states at the same time. So we should hear more from the State Department today. And then we also have a call with them every Wednesday morning, so I'm sure we'll hear more on Wednesday as well. They've been really good about communicating details and what they're hearing from the Attorney General's office and keeping us updated as they have more information. So I do anticipate we'll have more information one way or the other in the next couple of days.
Thank you. Commissioner Shattuck McMillan.
First off, let me just say, I know you probably all have been experiencing some of the anxiety and sleepless nights that I have been having over this, and I want to just thank you all for your tireless efforts to wrap our heads around this and try to problem solve and find solutions. And so I want to just acknowledge, I appreciate you all. I know how much this is troubling on your hearts as all of us. So secondly, I have been meeting with like Meals on Wheels and other folks who came and last couple of weeks we've been having conversations. They haven't asked us for money. They're just saying, how can we help you? How can we convene? What can we do to come together and talk? And, other areas what can we do to support you all and support, this effort? So we've been trying to wrap our heads around what does this look like. So my thoughts, a couple of questions, I'm going to ask them together is, if folks are not getting benefits, and if there's zero balance, sounds like there's quite a few of those, then there might be other things they're not paying for, like medications or transportation, or maybe staying home from work or because they can't afford gas, right? And so it seems like there might be a lot of rippling consequences. That'll be hard to maybe, how do you recover from some of that? And then secondly, I don't think it's lost on any of us that we're heading into two major holiday areas, and this is what's been bothering me, because I know at Kids Pack they at least give a bag to go home for the holidays, because I volunteered for that for 12 years, and there's a big bag that gets extra stuff before the holiday. And so I'm wondering, do we need to how do we, and I mean as a community, plan for, especially since half of these are kids, because they won't be in school, so they're not getting their breakfast and their lunch that they would get at school. So how do we kind of, besides the immediate response, I still feel like there's going to be a lasting ripple effect. What is our role? What do we do to help kind of plan so those, in case there's still disruption, make sure kids don't go in the holidays without food? And I know there's lots of community efforts. There's a lot of people just jumping in, and we have lots of examples of folks making sure that at least they have meat and some protein, and people want to donate. But it feels like everyone's trying to do something, and I don't know how do we organize it? How do we do this? And I'm just thinking about the holidays when even less resources will be available for kids because they won't be in school. And that's what's weighing on my mind as well. Thank you.
I don't have a quick answer for you other than we will, if there is not the issuance of benefits by Wednesday, we will then develop a very quick plan where we're pulling together, convening with community partners. I spoke with Tom Gonzalez last week about the impact to WIC and formula specifically. So we will have, and we have those contacts and have had some communication over the last week. But I think until Wednesday, we won't know how long this could potentially go on. And then we will convene a group and figure out what the short-term strategies are to make sure that people know where food is available and how to access it.
Thank you, and please let us know how we as Board of County Commissioners can support you and help message or whatever we can do to help convene, connect, or whatever you all need, because I do feel like kind of getting this sensitive period where we're all going on. It's the holidays, and I just want to make sure kids aren't hungry on Thanksgiving or Christmas. Thanks.
Thank you.
Yeah, I think we all want to make sure kids aren't hungry ever, right? Well, interestingly, as we were talking, I just got a bleep of information, and it looks like there'll only be partial payments for this month. So at least that's what the administration says. So that presents a whole new ballgame, and I think we'll pivot and figure out what that looks like in our community. Almost shocking to me to discover that this is considered a discretionary program, food. I mean, food is like the least discretionary thing in the Maslow's hierarchy of need. It's pretty much the most important need that people have. So that feels a little shocking. And one of my questions before I received that update was going to be around, could the administration appeal that decision, that judicial decision? Apparently, we can make up the rules as we go along here. Not you guys, but the federal government. So really disturbing, to think about people in our community going, having those needs. But I so much appreciate all of you for keeping us posted, for having a plan, for being in touch with all these food providers, really the reverse calling of folks to let them know what's available in the community. I mean, these are things that we can do and you are doing. And so I think as we face like what feels like a dystopian kind of situation here, I'm sorry, we're not feeding people in our community. That just is really hard to stomach. I just appreciate the work you're doing, because I mean, you can throw your hands up and be like, well, there's nothing we can do, but clearly there is stuff we can do, and you are doing those things. And so do keep us posted on ways that we can help, pressure that we can put on. I know that the CCI leadership sent out a letter to the senators and congresspeople saying, please get back together and figure this out. And I think that stays as the messaging, but let us know, obviously, if we can do anything. And we'll probably be talking as a board, of ways that we can help. If there's, funding that we can provide in any crucial areas. Clearly, people, are going to prioritize food spending, and that might mean other spending doesn't happen. So whether that means people that are more likely to be evicted or not pay their electricity bills, and so it will have a cascading effect in that way. And so we'll be looking at ways that we can help if that stands, that people will only be receiving partial payments. So thank you for your continued work on this, and I guess we'll go on to HR, which is like I don't know if that's anymore, probably the same kind of news. So
Yes.
with that, Thank you.
Thank you. Just to come back to Commissioner Cavales' question, so for the SNAP recipients, there's 16,264 are children. A little over 3,200 are older adults. And then a little over 4,800 are adults with disabilities. So those are the 16,264 are children. 3,253 are older adults, so over the age of 60. 4,879 are adults with disabilities.
I'm sorry, Madam Chen, can you say that one more time for children, please? 16,000?
16,264.
Okay, I missed the 200, thank you.
Thank you. That's helpful.
Okay. So just confirming, you do have this slide. Okay. Just wanted to make sure it wasn't printed every other slide. But so just really quick, we presented the high-level changes on October 8th. So wanted to just summarize those here. And with the government shutdown, the additional direction that states have received has been very slow, but we have received some of that guidance. So we wanted to make sure to update you on where we have received guidance. And then we're going to pull it all together and give you 5 client scenarios of where this will become the most impactful, the SNAP and the Medicaid changes coming over the next couple of years, and give you a variety of scenarios to help you see at the individual level for those that we're serving where these impacts could come to light. So I'll have Hannah just summarize this again, and then we'll dig into the detail of the new information that we have.
Great. So in terms of changes for SNAP, HR 1 changed who will be required to meet work requirements for able-bodied. So this will include able-bodied adults up to the age of 64 with some exceptions. Previously, it was able-bodied adults up to the age of 54. HR 1 also limits SNAP eligibility to U.S. citizens or lawful permanent residents. And it eliminates SNAP Ed, which provides nutrition education and helps those SNAP dollars go farther. And then it also shifts cost to states in 2 significant ways. One, it reduces the federal administrative match for the program from 50 to 25%. And with this shift, Colorado expects to lose approximately $50 million. This is effective October 2026. And it requires states to pay a portion of SNAP benefit costs based on the state's SNAP payment error rates. This will be effective October 2027. And if Colorado's payment error rate remains consistent, we're estimated to lose approximately $125 to $160 million. And then HR 1 also makes changes to Medicaid. Like SNAP, it limits eligibility to U.S. citizens or lawful permanent residents. It requires Medicaid eligibility redeterminations to occur every 6 months as opposed to every 12 months, which will increase our administrative work and will increase administrative burdens on clients. It includes an activity requirement or work requirement for individuals aged 19 to 64, with some exceptions. It also increases administrative work for us, and it puts a limit on provider taxes that the state uses to then increase the match that they receive from the federal government, and then uses that match to support healthcare facilities in the state.
Questions on that high level before we break it down a little bit further?
I don't think I have any questions right now. Thank
Okay.
you.
So taking those, there are a couple of pieces where we do have additional direction. So taking those into chunks, if you will. So the first one is regarding the change in immigration and SNAP eligibility. So again, as Hannah said, the changes are there on the left. So it removes certain refugee and other humanitarian immigrant populations from being able to receive SNAP benefits. That provision was effective July 4th of this year, so on the day that the bill was signed. And CDHS, the State Department of Human Services, just received guidance. It was sent to us at 5 o'clock on Friday, so they just received it last Friday. And so what I've captured here on the right is the guidance that the State Department has received from the federal office. And we'll highlight, Vanessa will jump in if there's any details I miss, but we'll highlight where there is still additional detailed guidance that as the implementers at the county level, we're still waiting on from the State Department. But here's what we know at this point. So again, it is only U.S. citizens, U.S. nationals, lawful permanent residents, Cuban and Haitian entrants, or others that might enter the country under what's called Compact of Free Association citizens. That is the refined group that is eligible for SNAP benefits moving forward. So it's the removal of other legal immigrant populations that are not citizens, other refugee or asylees that might have come from different countries for different reasons, as well as human trafficking survivors that might have come and sought asylum. The state agencies are required to immediately apply these new eligibility requirements. And the bill, when it was signed on July 4th, gave a 120-day hold harmless provision. And there was a lot of questions and confusion about when that hold harmless period would actually expire. Would it be extended? Would the hold harmless start after we received guidance, or does it start immediately after the bill is signed? And what the direction that was received on Friday outlined is that the hold harmless period started the day the bill was signed, and the hold harmless period then expired on Saturday, November 1st. So for households that are impacted by these changes that are receiving SNAP benefits today, our understanding based on the direction is that they would continue to receive the benefits until their redetermination period, until they come forward for their normal recertification process, or if they're reporting a change to us. So if their income changes or their address changes, there are a handful of changes that the household has to report to us in between those recertification deadlines that we would also then be required to re-review for their eligibility when we're processing that change. And like I said, there is still a lot more detail than that we need from the State Department of, do they expect us to be more proactive as the guidance suggests states should be? Should we be trying to identify these households outside of these redetermination periods? How does this look at the local level? And what changes will the State Department build into CBMS that auto-generates some of this work for us? That's the level of detail that we still need from the State Department before we're able to act on this. And they communicated late on Friday when they sent this out to us that they are actively working on that and hope to have something to us very soon. For Colorado, it is an estimated amount of 4,000 people that fall in this category that will no longer be eligible for food assistance. We don't have a large population of them locally, but we can come back to you with that number if that's of interest. It is a much smaller population for our county, but we can provide that data point to you. Questions on this piece of it?
Commissioner Cafalas.
Thank you. What additional support and perhaps comfort are we giving to our eligibility technicians? How are they holding up?
Yeah, happy to speak to that. We certainly are navigating these changes together, right? So we really do continue to operate with our, hope language as much as possible, pathways and support, and being able to provide those resources to the specialist who then is going to be on the phone with that client, and working directly with that client, trying to make sure that they're as equipped as they can be. I do think that this reverse outreach process is a hopeful process for our staff to be able to offer. A lot of times they don't have the ability in their conversations in determining eligibility or doing redeterminations to really offer resources in this tangible way. A lot of times it's go to this website or here's the food bank information. They don't have an opportunity to have more dialogue because we've got so much work that needs to be completed. So it's definitely a shift. And I do think that when we have these kind of variety of moving parts happening with programs all at once, it's confusing for us. Every time we sit down and talk through this, I feel like I understand it better. So we try to just continue to introduce the changes and reintroduce them to our staff so that they can understand them and internalize these changes so that they can get it right for the client. As the payment error pieces continue to be an elevated conversation, these changes impact then whether or not we're getting it right. So we want to make sure that we're offering and providing as much support as possible. We rely heavily on our management team for that as well, for our managers to be able to recognize signs of burnout, to support staff, make sure that the training is available to them, really anything and everything that we can to let them know that we understand that they are the face of this for our customers.
Okay. The next piece that I will touch on is the work requirements. So again, as Hannah said, expanded work requirements up to the age of 64. So previously they were up to the age of 54. And they're called able-bodied adults. So it is now 19 to 64 years old. It also removed some exemptions for parents with older children. So previously, parents were exempted if they had children under the age of 18, and it is now under the age of 14. So parents with kids 15 to 18, 15 really up to 19, will have to meet work requirements where they might not have previously. The other significant change is the third bullet there on the left, and it actually removes exemptions for individuals who are unhoused as well as former foster youth. They were previously exempted from work requirements and now have to come into compliance with work requirements to receive SNAP. So what we know on the right, very similar, the hold harmless period ended on Saturday. Some of this work we knew that these changes were coming, and because we already have work requirements in SNAP, it is easier to scale that because it's something we already do for a large percentage of the SNAP recipients. And so a lot of this work had already been happening. So for households that are impacted by these changes receiving SNAP, again, they will have to show that they meet this requirement when they come back for their recertification. We are working on the details of what that looks like with the State Department. Is it a standardized form that they need to provide? Can they just self-attest that they meet these requirements? What do they have to show us to meet this requirement? Is the level of detail that we're still working on with the State Department. And for Larimer County, this impacts about 4,200 individuals who will have new work requirements. 968 individuals are people who were previously exempted because of homeless status that will now have to meet this requirement. And there is an immediate impact on trying to be very creative in how we provide those resources to this population that is going to grow quite a bit. so that we're able to help them know how to find a job, where to find a job, or potentially exploring another type of waiver for a disability status, or perhaps there's another waiver that they could be exempted under if they're losing the current waiver that they have. So not a lot of new information, other than we are working on the implementation logistics of how this expanded population will have to meet this requirement and what type of documentation they'll provide and the timing of when that happens.
So right now, somebody could get potentially a waiver if they had, mental health issues or physical or intellectual and developmental disabilities would have a waiver, right? But you're not sure if they would have to provide sort of a doctor's report or what that looks like at all yet.
Our understanding is that those waivers will still be in place and the process to obtain those waivers will remain the same. But there might be, what we know about chronic homelessness is that there often is a disability or a mental health condition that happens that person is struggling with. So the process to potentially move someone from a homeless waiver to a different type of waiver, I think is what we're still trying to figure out how best to do that with community partners that are serving those individuals as well as the eligibility team. So, but there will be 4,000 or so individuals that don't receive a waiver of any kind that will need to start meeting these work requirements.
So, obviously, like our partners, Homeward Alliance and those folks are aware of kind of this and will work on waivers for the people that might qualify for that. Sort of easier said than done finding a job if you're experiencing homelessness. So, are we working with, our folks in workforce development too? I mean, they're losing money. I mean, do we have any sort of idea what that might look like? I mean, we'll just.
Do you want to speak to our staff that go to our community partner locations, but then also your work with Marcy? Sure.
So we have two staff who support our customers that are at the community justice centers in those respective programs. And then also they will go to the Denver Rescue Mission, to the mission, to support customers there in applying for benefits, maintaining benefits, those kinds of things. So those staff will continue that work and supporting in this process of if you are receiving SNAP under the homelessness waiver, then how do we support you in scanning for other waivers? Finding those and then supporting folks, and be it supporting them directly or working with another case manager to support them in qualifying for that waiver. So that's kind of the community-based side. And then partnering with internally, I meet regularly with Marcy from Economic and Workforce Development. They have programs where they're monitoring for people coming in their front door and referring them to us. And then we also have a process to refer our clients so that we have kind of this pipeline from benefits to workforce support and training. As you said, as they're also experiencing fiscal shifts, we're kind of just doing our best to support customers from whichever perspective we can provide that. So our case management team internally does some of that, like resume writing, interview support, but then also like what trainings can they receive through workforce development, what's available in their respective programs, co-enrolling them in the Workforce Innovation and Opportunity Act program. Wherever we can, we're trying to plug folks in, recognizing that depending on that individual's needs, right, we may not have a match for them all the time. So we're also partnering wherever we can with Front Range and AIMS. We do some also referring through those programs to try to connect people to training, because training can count in these work requirement processes up to a point. So training, volunteer hours, as well as work and job search. But that job search piece is getting smaller, right? How long you can take to look for a job is a piece that is changing.
Thank you for explaining
Yeah.
that. I appreciate that. But we're still estimating that 4,200 people won't, like, be able to move, let's say, from the homelessness waiver to a mental health waiver or some other disability waiver, that there's people gonna, okay, thank you. Commissioner Shattuck McNally.
Thank you, Madam Chair. So and forgive me, my head's spinning with lots of questions and thoughts about all of this, as this is pretty perplexing. So I'm just going to ask kind of something that was in my head, trying to think about what does this look like. So 2 questions. First, if someone during this HR1 transition loses a job and is trying to find a job, is there a so that's my first question, is there a time period of forgiveness or waiting for them to find another job? And what does that look like? Because there are some folks who maybe through this shutdown stuff, or the federal employees might have gotten, their jobs cut during this process. And I'm just thinking about some of those folks too. What does that look like? That's my first question, Madam Chair.
Yeah, so you ask a great question, the logistics of people's lives changing, and then how does that relate to their status in the program? So you might have someone who would be considered an able-bodied adult in that ABOD requirement, but they were working. So they were meeting their work requirements, and then they have a job change. So now, at their next redetermination is usually when we know that, due to what they call simplified reporting. So at that redetermination, then we would inform them that you are now needing to meet work requirements. Maybe they knew that before, didn't understand it that way because they were employed. So now how can we get you connected? Because then they still have that 90-day period from that they become, they were in ABOD before, they're still in ABOD, but now they're in a different status because they're no longer employed. It's nuanced, right? So we would then inform them of that, refer them to our Employment First program, provide those supports wherever we could, but it's a 90-day window that they can continue to receive benefits without meeting that work requirement.
But just to go back to the detail that Vanessa shared, I think in an earlier question, meeting that work requirement, there is a job search activity that they can show compliance with. So if they are actively searching for a job, if they're volunteering or they're attending training by the 90 days, that would still meet the requirement, even if they aren't yet employed. So there is the change in status for all of the public benefits programs is very nuanced. And there are a variety of ways that person has to show compliance by the 90 days.
Well, I'm thinking about some of those folks who are not only the folks that are in great need, but also we have a lot of federal employees that's in this area that are impacted by the shutdown and might need assistance through this time, and maybe they're fronting out their, but it's all very complex because there's a lot of nuance there. My second question is, and maybe you said this and I'm not connecting the dots here. So if there's someone is able, who might be losing these benefits and are living out of a car or something and considered homeless, but they also have children. So does the adult not qualify, but the children do, or the whole family is not I'm curious about that.
Yeah, so back to those work requirements expansion, right? One of those is, it used to be if they had a child under the age of 18, now it's if they have a child under the age of 14. So depending on the age of that child, if they have a child under the age of 14, then they are exempt from the work requirements. But that is a change for people who maybe have, they might have a 15-year-old today and didn't have work requirements, and now they do. So that shift, they're making sure that household with the 15-year-old, and this is in our scenarios as well. So as we're trying to understand it ourselves, we'll help you kind of walk through and think about what is that household scenario, and then how does that align with how will they be impacted by these changes?
Thank you, and thanks for reminding me of that I remember that now. So, but I was trying try, okay, if this, but then this, if not, then this. And so it sounds like you should make this flow chart and maybe put it in a computer thing, and I'm sure there'll be people all around the country wanting to buy in. So thank you. Thanks, Madam Chair.
Okay, we are actually going to skip the next slide, if that's okay with you. There are changes to the utility deductions that people can count towards their bills. And the short story is we were able to get an emergency fix built into CBMS over the weekend. So we've already implemented that, and that's moving forward. And there will be really very little customer impact to that because it will happen in CBMS, and then we'll answer questions as they come. Okay, this is the payment error rate. So this is the cost shifting that Hannah had mentioned. So a really crucial piece is the cost shifting is required to be implemented under SNAP October 1st of 2026, which means that the measurement period for our payment error rates started October 1st of 2025. So our payment error rate will be measured from October 1st of this year through September 30th of next year to then determine what Colorado might have to share in the cost of benefits moving forward. And then over time, they're going to use a rolling 3-year average, and it becomes much more complicated. But so the strategies that we've just talked through are really crucial because we're already in the measurement window for determining what we might have to share in the cost for. And then the shift in the administrative cost, where the feds will now only pay 25% of the administrative budget, whereas before they paid 50%. So just touching on that before, I'll ask Vanessa to share what's happening in statewide work groups around the payment error rate. So the governor's budget was released on Friday, and we have not had time to digest it. But what I will tell you is that there are some really significant impacts for human services related to the budget across multiple programs, not just SNAP and Medicaid. So I was talking with Lorenda. We will schedule a work session with you here in a couple of weeks. But we do know that some of this cost shifting is already built into the governor's budget request because the state fiscal year will be July of 26 through June of 27. And so it will cross over when we're starting to implement some of these pieces. So we'll come back to you once we have a better understanding of what the governor has submitted to the Joint Budget Committee and what the local impacts specifically will be there. But there has been a lot of work. The governor has set a goal of by October 1st of 2026, Colorado's payment error rate will be 5.99%. We are at 9.97% currently. It is a great goal, and it is a very lofty goal, honestly, to cut our payment error rate in almost half in less than a year. But there is a lot of, there are 7 or 8 different committees that have been pulled together with the governor's office and the state departments. So I'll just have Vanessa touch quickly, quickly on those work groups as she's helping to lead and sort of wrangle the counties so that the counties are all on one page as we participate in these strategies.
Yes, so the payment error rate projects have multiple work streams, and we have done a lot of advocacy to make sure that there's county representation on each of these work streams. So CDHS is really coordinating sort of from their perspective, but then making sure that the county perspective is represented. So the county support piece is just making sure that we are at the table talking about what counties need in this process. And then the data and evaluation. So the CDHS, Colorado Department of Human Services, sorry if I didn't say that earlier. So CDHS has pulled a lot of the data on how our payment error rate is determined, and then what are the root causes of those. And then the county representatives are really trying to help them further tease out what really can we control at the county level, what kind of client education might need to happen to ensure, because of there is a large number of errors that are considered client errors. I think we've highlighted here already today how confusing these programs can be. And so you might provide the wrong information in the process somewhere along the way that leads to that dollar amount landing on that EBT card not being 100% correct. And all of the factors that go into what lands on that card. That really is where the payment error is being evaluated from. So there are client errors, there are administrative errors, county errors, something that happened with our staff that where they got it incorrect. And then there are system errors, how our systems interface with one another, how we find out employment information from another system, for example, and then how that affects the outcome of the eligibility case. We're trying to better understand what CDHS quality assurance process is. So if we can understand what that process is, we can align it wherever we can. We're also trying to really highlight where there are differences from what happens on the eligibility side because of the guidance that we receive from the state versus the way that quality assurance at the state level evaluates a case. There are significant differences between those things. So there are a lot of factors that go into the payment error rate, and we're trying to break all those factors down and determine where is the biggest bang for our buck, if you will. And really making sure that we're not going down a data rabbit hole that's not going to lead to an impact in bringing this to 5.99%. So we're spending a lot of time in the data, in conversation, trying to contextualize the data that we do see, make sure we understand what we're looking at, and that we're on the same page, as Heather said, as we move through the process.
Commissioner Shannon McNally.
Wow, thank you. Curious, there's 64 counties, and is there what kind of support or funding is to help all these counties how is this, what kind of support are you guys getting to try to work together to navigate maybe what areas need to be adjusted? Is that a clear question? I'm just thinking, I mean, I can see one county having lots of resources to try to match this, whereas maybe a smaller county, this is not a lot of capacity support to make changes or look at that. I'm just curious, but maybe don't have the same caseload, so I'm just curious about the wide range of status along the spectrum of providing services.
So that's the crux of the issue. This all happens within our county administration allocation, and is up to then how counties spend there's very little flexibility of how we can spend the dollars, but we do have a QA team that we invest as part of our allocation. So we do have a team that's under Jill's leadership that is reviewing these cases and working right alongside Vanessa to make sure that as the state is shifting things through these different work groups, that we are making sure we have the right access to the data and all of that locally to be able to shift quickly. And then what do we do with that information into training, into supervision? How do we use that information in real time? And there is just a variety of different systems. We put a lot of this information into Tableau dashboards so that the managers have it at their fingertips. And there is a significant disparity in the tools that counties have across the board. Even large counties have very different tools. So that is exactly what some of these work groups are tackling, is what do counties need, or what are counties already doing that we could contribute into the state's QA process so that they're not duplicating and wasting resources there. So a lot of work and coordination happening between the different work streams so that we're trying to stretch the dollars as best we can, knowing that it is limited across the board.
Thank you.
Commissioner Cavales, please.
Thank you. in the data and evaluation part of this process, are we also looking at the methodology used? Because I seem to recall from our wonderful detailed payment error rate fact sheet, I think it's like a 1% sample size. Is that something that's being considered? Could that help improve the accuracy of the data, perhaps?
So I would say, yes, it could help improve the accuracy of the data, but Colorado has been given a very clear no from FNS. There is no flexibility in that methodology. There is no flexibility in the sample size. So we're trying to understand both at the local level and the state level then more detail into that methodology so that we can leverage pieces of it and be as strategic as we possibly can. There is no flexibility at the federal level with how they are going to survey. And they go back and reprocess the case. So they actually call the household, which is why the sample size is so small. The level of, it's not really an evaluation in my perspective, it's an investigation. They are calling the household and they are asking them to regurgitate all of the detail and all of the documentation. And sometimes that case is a year, 18 months old. So the level of detail that they're evaluating those cases is a lot changes in a person's life in 18 months, particularly when you're grappling with all of these challenges at the same time. So we're trying to just understand the process that they take so that then we can shift locally. If we review the cases more closely to when we're determining eligibility, does that shift then in the opportunities we have to use the information? So gaining better insight into their methodology has still been helpful, even though we've been given a very clear, there is no flexibility to how they do it.
Are the states that are, so the error rates, other states are dealing with this, but is it true that this is one of those, that we're one of several states that run this through at the county level versus the state level? And do you see more lower error rates with people who are at the state level just because there can be more centralized control, or that's not necessarily true?
Yes and no. There are some states that are state administered that have lower error rates, but they also have lower access levels to the program. The county administered states have, they provide actually the highest level of access into SNAP benefits, so the caseloads are bigger. But there are county administered states that also have lower error rates than ours that we're trying to learn from through national associations.
Yeah, that's, I guess what I was wondering is kind of some best practices around that, because I think that we're not going to affect that sample size and that kind of the methodology, but maybe we can figure some things out. And I mean, 5.99% is a lofty goal, but I think thank you for looking into it, because I mean the more we can lower it, the more beneficial it'll be for us of getting dollars back. Because that's a pretty hefty penalty to pay.
Yes, it will be significant. Okay, so not a lot of new guidance on the Medicaid work requirements, but a piece that I wanted to highlight that is, I think, very confusing in the changes that are coming. So there are work requirements coming to Medicaid similar to work requirements in SNAP, but they are specific to the expansion population. And so here you can see the graphs, the data on the right show how our Medicaid population is broken down. And it's just shy of 28,000 that fall into the expansion group for us. So the expansion group is under the Affordable Care Act. Some states expanded eligibility to Medicaid further than other states did, up to 138% of federal poverty. So you have a standard Medicaid eligibility, and then you have a gap between the standard eligibility up to 138% of the federal poverty. That's the expansion population, because Colorado chose to expand Medicaid to adults that are not eligible under the standard Medicaid eligibility at the federal level. And generally, most of them are adults without children that fall in that category. So this is the subset that is now going to be required to meet work requirements. Able-bodied adults, so using the similar term from SNAP. And this is also the same population that will have their redeterminations moved to every 6 months instead of every 12 months. So when we say that the workload is going to double, the workload is going to double for this subset of the population, not for the entire Medicaid population. So it's a really important distinction, but it is still really crucial for us that we are going to go from 27,000 redeterminations a year for this population to 54,000 within the same staffing and resources. So it is still a really significant increase in the administrative workload for our teams, but also certainly for the work requirements coming for this population. But I wanted to just make really clear, it is not the entire 70,000 some that receive Medicaid in Larimer County. It is that subset of the expanded population. And we've captured this a little bit in our case scenarios too, to make it clear. Okay, so we'll walk through, and a couple of these we've already touched on in some of your questions. So we might go through this somewhat fast to make sure that we get to it. But Thad will cover this first one that provides a case scenario that also includes our child welfare services.
Yeah, so thanks for the time. This first example gives a nice little snapshot, honestly, because about 80 to 85% of the referrals we get into child welfare have neglect as kind of the bucket. And in our world, we often talk about with families coming into our system on their very worst days, right? And so there's all the crises that kind of lead to that moment that causes a call to us and gets involved in child welfare. So this case scenario is a single mother who has two children, ages 4 and 14. So there's some nuance, right? Some of those waivers apply, maybe they don't apply because there's a 4-year-old, but there's also a 14-year-old, so that it becomes very complex just looking at that household alone. And obviously, we pride ourselves in keeping families in the home and with their children, but the social benefits programs are risk mitigators for child welfare, right? If you have more resource in the home, you have Medicaid, you have SNAP, you have all the programming and the case management that might come with those programs, that is a risk mitigator. So you start peeling some of those things away. It actually increases the risk of future potential child maltreatment. Now, none of the neglect by itself, none of these events causes child abuse and neglect, but it is the crisis that evolves into abuse and neglect that often happens. So, first perfect example, this mom probably has access to SNAP, Medicaid, TANF, child support, and other programs historically, right? Depending on if there was no waivers, if there's no eligibility requirements, and there's no freezes. The challenge starts trickling down, obviously. When you have SNAP and Medicaid work requirements, it's hard to have work if you don't have daycare for the 4-year-old, and you have a freeze on our CCAP waiver. So now doing work requirements maybe starts getting in the way of meeting some of the requirements because of not having daycare, full-time daycare. Maybe you have some of that through the preschool programming. So obviously that impacts access and supports, and then there's these are competing interests. We'll have a treatment plan that would be associated with this parent that is, stable housing and work and therapeutic interventions. Well, if Medicaid all of a sudden becomes you are no longer eligible for Medicaid for some reason, that Medicaid resource that used to be able to fund the therapeutic intervention or the in-home treatment or whatever that might be, then starts coming back to child welfare. So we really leverage Medicaid to provide support to families that have Medicaid. When they don't have Medicaid, we're still responsible to making sure that they have access to those supports. And so the shift starts coming back to child welfare to pay for Medicaid treatment. And we do a lot of in child welfare, kind of the hard service dollars, if you will, to kind of patch the holes for families so they don't have those crises. So if you're losing SNAP, you have less food in the home, you have less income. Those are spaces that we might help invest historically hard service dollars to kind of bridge that gap. You have less community resource, you have more of that coming back to child welfare. You're already very aware of where our budget scenario is in child welfare, so we're already well overspent in that population. We anticipate some increased core service needs coming back to child welfare because of the impacts of Medicaid.
Sure. So here we have a two-parent household with one child, age 4, who applies for Medicaid and not yet meeting work requirements. So we'll screen them for all appropriate programs, as we do with every application. But in this scenario, we don't know how Medicaid work requirements would apply to two-parent households and the age of the child. So we still have unknowns as we wait for guidance to come in. In the previous scenario, same issue with access to childcare. And if without access to childcare, how then do the parents work? So our case management, employment resources, if they're available, if they're eligible for TANF or SNAP, we would want to get them, move them into the TANF population if we can, so that they can get access through that avenue to case management resources. But depending on their eligibility for SNAP, they might not have access through that door. And then we will be in a position where we'll have to tell folks, well, maybe you're eligible for SNAP and TANF, but not Medicaid today. So then we want you to come back and apply for Medicaid when you are eligible. Whereas we'd really love to be able to just do that determination off the top, but those work requirements for Medicaid, if you'll remember, those work requirements, unlike SNAP, where you have the 90 days, you can receive the benefit and have 90 days. For Medicaid, it will be you must be eligible before you access the program. So we'd want to get them into another program first, provide those employment and training resources there, and then add the Medicaid later.
Okay, stop us at any point if you have specific questions.
Commissioner Cavallos.
Thank you. Thank you, Vanessa. I believe I've asked this question before, and it speaks to the extraordinary patience that you all have. But when do we anticipate receiving the guidance on this particular matter, work requirements as they apply to two-parent households?
So there's two pieces to that. There has been some limited guidance that Healthcare Policy and Financing, as the state office over Medicaid, has received from the Centers for Medicaid Service. CMS is the federal office, that the Attorney General's office is wading through to understand, but there is more detail that is still needed. And these work requirements for Medicaid go into effect January 1st of 27. So we do have a little bit more time under Medicaid, whereas the work requirements for SNAP go into effect last Saturday. So we are still meeting weekly in multiple different venues with HCPF, but we do have a little bit more time to sort through that. But the challenge is that many of these families are accessing both programs. But like Vanessa said, it's also a strategy of us to make sure that they are accessing other programs they might be eligible for that could then help bridge that gap to make sure that they're meeting the requirement when it does come. Okay, the next, I think it froze, I think. Let's see. There we go. Okay. The next one is going to speak to the former foster youth population and the changes to SNAP eligibility.
So one thing I'll highlight in the two scenarios before and on this one as well, the last bullet is recommend returning to apply. So you think about families that already have a lot of stuff that they have to do. We love to be able to package it all at one time. It's really frustrating for all of our systems to be like, but come on back when you're ready. And the reality is when they're ready and when they have capacity and all the other things, those are very much competing interests. So kind of highlights the challenge that to provide good case management to keep them engaged so that we connect them at the right moment. So I'll just flag that real quick. So foster youth in transition, piece of legislation in 18 or so. So we are now able to reopen on kids after they turn 18 if they exited foster care. They can come back to our system, and there's a stipend program associated with that. It's really intended to meet their basic needs, like a housing first program is how it's defined. But there's a lot of things under housing, and there are oftentimes, they also have requirements as part of our foster youth and transition cases that you have to have either be working, going to school. And so it's a similar alignment on some of the work requirements. So I think there's an opportunity for our case managers on foster youth and transition cases to help support these kids in a very different way. But still in child welfare, so the challenge is this population that has exited foster care, if you can imagine, they have a life of kind of in some instability, some trauma in their past, and so holding down jobs may not be one of their greatest skills, right? And so it is an ever-changing population that they lose their employment, maybe they find employment, and so luckily for this population, Medicaid will stay in existence for this group of folks because they've exited out of foster care, so they actually have Medicaid without having those requirements. So that's one of those nuances that's a nice leverage point. But the SNAP component, it becomes much more challenging. Easily about a quarter of the kids that are in this program right now are accessing SNAP. That's our loose estimate. The reality is that that's probably a much lower number than what we would be able to eligible for. And it is, with the work requirements will become a challenge for them in the future, just meeting them. Luckily, the SNAP has a little more flexibility than the Medicaid work requirements. We do provide case management as foster youth in transition, and we also partner with our community, Chafee Services through Matthews House. Again, it's another perfect example of resources that are woefully underfunded already, and then we have to tap into those. So Chafee, we don't get enough Chafee allocation as it is now to do Chafee program. Foster Youth and Transition program that we're funding out of Child Welfare Block is an entirely unfunded mandate from the state, and so we spent almost $800,000 in this program last year. We did statewide in the fiscal note in 18 was $800,000. So if you think about having unfunded mandates and then young youth coming back to us to pay for additional costs from a pot of money that we didn't get any increase in to help pay for those services, is just adds growing pressure to us. We're seeing a lot of successes in this program, and there's also a growing worry that there's still a population of these folks that we've just created a cliff effect from 18 to 21. And so that's the old cliff effect. They left foster care at 18. They had all the problems, the homelessness and all those kind of things. There's some population of this group that still isn't overly engaged in the program. And so at 21, they're really have not gained a great deal amount of skill. And then the same cliff effect happens at 21, that it will further impact their Medicaid eligibility and SNAP benefits after they exit foster youth in transition as well. This one's a nuanced one, and I think there's a lot of opportunity to kind of partner in this population. It's not a huge population. It's about 28 cases that we have right now in foster youth, 28.
And we have asked the State Department if this could potentially be a specific waiver because of how Colorado defines this population. Are they still federally considered part of foster care even though they've returned? If they are defined as still being part of foster care, then we might be able to get an exemption for the work requirements. But that is the level of direction that the State Department is still waiting on from the federal partners. So want to cover just one more client scenario because it is a really important one. And then the fifth one that you have is similar in strategies to what Vanessa's already covered. So Lori will walk us through this fourth one.
Good morning. Yes, it's still morning. Lori Metz, Division Manager, Aging and Adult Services. So our scenario is about an individual who is a woman, 61 years old. Unfortunately, same song, just different tune is what we're going to share here today. So they contact the Office on Aging. It doesn't sound like it's in a crisis, which that's wonderful. That's part of our goal, is to be available to people as a resource before the crisis comes. They're going to be screened for eligibility regarding the internal resources and the partners that we fund through this program, SNAP, Medicaid, other programs and resources, and that's exactly what's done today. If this individual is not working or volunteering that 80 hours a month, she will not meet the Medicaid work requirement. And until we have the definition of those exceptions for able-bodied adults for that, that group that's now included in that working piece, we won't know how to help her. Case management, employment resources, if they are eligible for SNAP, where are we going to go with those folks? And then again, the recommended returning to reapply when they meet those requirements. And when Thad was talking, it just struck me because it doesn't matter which part of the lifespan you're on. This is going to put a stress on already the providers that we have in the community that we haven't been able to fully fund for a number of years because the cost of doing business for them has increased and gone up, and our funding has largely stayed flat in through the Older Americans Act and the State Union on Aging. So I think regardless of the age, we're going to see the same sort of churn of individuals and then the stress on the community resources and our funding.
Lori, I have one question. Is this part of that expansion of adult group? Is that what we're really looking at here? That's largely going to be the older adults, the single adults, no families, no children?
And for 54 to 64-year-olds that have left the workforce for whatever reason, re-entering is even more difficult in that age group too. So the partnership that we have with the Economic and Workforce Development Department and the tremendous expertise that the Office on Aging has will all be great and give us a good foundation to build on, but re-entering the workforce in that age group to be able to access food and medical care is going to be even more challenging. So we will have to, I think, identify some very specific strategies for this group in particular.
And then 80 hours of volunteer work in a month is called out in this example. So that would qualify if they couldn't get back into the workforce, they could get into the volunteer workforce and still stay qualified.
So the 80 hours is how HR 1 defined the Medicaid work requirements, and it is so it's 80 hours of volunteering in the prior 30 days, or 80 hours of work at the federal minimum wage rate. So one of the pieces of guidance that we are asking for is Colorado has a much higher minimum wage. So in Colorado, it means less than 80 hours of working, but how many hours meets that requirement? So it hinges on 80 hours of employment at the federal minimum wage. And so if someone has worked at a higher rate than that, how many hours and how do they show compliance with that is a level of detail that we still need to figure out with the State Department and then also build into CBMS that determines the functionality there too.
Thank you.
I have a question about and maybe workforce might have more of this, but, and I don't know, Lorinda, if you've engaged with the chamber on this, but there is some question about, local employers and how they're able to really help us with this piece. I mean, there are big box stores that specifically don't give their employees a certain amount of hours because they've relied on the federal government to be their de facto insurance for their employees. So what does it look like to engage our community, or our businesses in our community? And, or, if you can't give me 20 hours a week, then can you work with me with a flexible work schedule so I can find a second job to make those 20 hours a week? Because I think that there's some responsibility for our businesses to help with this situation. I mean, in many cases, their lower paid workers are relying on these services. And if people get sick or can't eat or can't get benefits, they're not going to show up to work. So to me, there's some community responsibility with solving this problem. Do we have any answers in that space at all?
So it is a perfect segue, and I'll answer Commissioner Kafalis's question earlier too about the local convening. So we sent out information a couple of weeks ago and had great response from people signing up after the work session for both buckets. We put them in two different buckets. We want just regular updates. So yes, I want to sign up for regular updates, or I want to contribute to developing solutions and figure out a local committee. We actually have a meeting this afternoon. We are going to leverage some technical assistance from the American Public Human Services Association that has a really good, it's very similar to a collective impact model. And they have provided to us basically a 12-month plan of here is how you can start to chip away at this. And who do we need at the table? And a big part of that plan is making sure that we have the right people at the table, but also that there's shared ownership. Some of these pieces we are actually prohibited from doing directly. outreach for Medicaid. We are not allowed to educate the community on the eligibility and the work requirements around Medicaid. We could receive a really significant fiscal sanction if we did that. But there is another community partner likely that says, yes, I would love to do that, and that fits within our mission. So how are we bringing together the right community partners to identify whose role is what, and then start to work through those action plans? The chamber is included. Economic and workforce development is included, public health. There are many partners that we have on that list, both other county departments, but then also community partners that we work with in different spaces. And we will then be bringing them together for probably a 12-month project, so that when these requirements come into play in Medicaid specifically, January 1st of 27, we're already well ahead and we already have some local solutions implemented to be able to wade into the details from the business perspective, criminal justice, homeless services. There is a nuance for each subpopulation with these changes that we want to make sure that we're identifying the local solutions, as Larimer County always has, in the best way, and approach this similarly. So when we will keep you updated, but we will certainly have that group convened before our next Board of Social Services meeting. We have heard from many of our community partners, they want to do something now. And what we continue to message is there is still significant details that we don't have, that we need before we jump into that solution space. So the timing and making sure that everybody understands what the changes are that are coming and where can we impact that is really important. So we're going slow initially, intentionally, so that then we can ramp up as we're continuing to get more details from the state departments.
Great, yeah, I think that is really important. And what does it look like to provide employment services and employ people who have experienced or are experiencing homelessness, or, foster youth and some of these folks that, it may be a little bit trickier and they may need some employment supports to be able to support people, but they can clearly be some of our partners in this space. And so thank you for that work, because I do think that that's really important for our employers to understand, how they can be a support system, and how, right? Because, there's employers who give you 12 hours a week.
Yes.
Right? We're not busy, or we're cutting back, or whatever, right? That can change people's eligibility then, right? And so, if they can understand the impact, and there again, it's a tool that they use to cut, if they're not making the sales in a retail situation, then you cut back on your, payroll costs, right? It's the only thing you can do, right, to keep your profits at the rate you need them to be at, but at the same time, because of these situations. Okay. Well,
And
thank you for
how
that
do
work.
we potentially then piece together maybe a second employment or volunteer time, but then the volunteer management is also a significant right? So there's a lot of different pieces that I think we're really adept at across the community in different ways. And so how do we bring that together and actually start to implement some solutions?
Thank you.
So that was a lot of information. Like I said, we will continue to bring as much of this as you want in future agendas. We'll certainly have this as a standing agenda item, but unless there is significantly more information, we may not spend this level of time unless you all would like us to. But we will schedule a follow-up work session with you all to dig into the state budget.
We have tentatively held December 8th, a Monday,
Oh, okay, good.
for that update.
Commissioner Shattuck McNally.
I'm just curious, and know if this is a bad idea, I get it. I know you guys are really besieged with all these changes, but so we always have questions, but I don't know if there's a document where you guys, if there are just little changes, we can all just access, frequently asked questions for us, just to have that information that you could add, so we don't bug you because you're already kind of super busy. And then maybe until we meet on the 8th, and we can just kind of I'm not in real time, but just kind of keep up to date with all these additions and questions, and so that I want to be respectful of your time, but, if you have lots of questions, and I hate keep asking, sending a text to Laura or this and that, well, can I get this question asked? It's just, I don't know if there's ways to do that, because maybe if we all have the same question, it's all there for us to share and save you all some time. I'm wondering if that's an idea or a possibility, just to be thoughtful and not be hammering you all with questions. Thank you.
So I can connect with Lorenda and Laura to figure out the best way to do that. We are still keeping the federal tracker updated, so Hannah keeps that updated. That is a resource you can go to for shutdown information or HR1 information, so we'll make sure to resend that to you. And then before we come back for the budget work session, we will digest the governor's requested budget in much greater detail and pull it out in a couple of bullet points for you, so that you at least have a sense of what we'll come back to discuss in more detail.
Thank you. Lorinda, Commissioner Cavallis.
Thank you. I just want to express my appreciation to all the hard work. Thank you very much. Also, I'd like to request, perhaps we could schedule a time that's not too disruptive. Maybe I could stop by and visit the eligibility technicians and bring them some healthy donuts or flowers or tickets to, I don't know, something. If we could schedule that, even for a half hour, 15 minutes, just to stop by and say thank you. Thank you.
Thank you. Thank you again for your work, and thanks for letting us know about, what you're all dealing with. And yes, we want to thank all the people that are helping make the calls and doing the extra work right now, and especially all of you, because it's not an easy time. Lorinda, any closing words?
I think what you do on a regular day is difficult, and these added complications are making it more difficult. And I guess just another extension of appreciation for the staff, the folks who are making the calls and doing the work and interacting with the public, trying to solve the problem. No one goes into this work because they don't care and they don't want to provide help to folks. And I imagine this is a very frustrating time for all of you, as it is for us, but those folks that are most closely related to it. Whatever we can do to help, if it does help to have visitors come, if it helps to have phone calls or notes or things like that come over, please reach out. I know the board is happy to help, and so am I, and so is Lori and Laura. So we're all here to support the team. We know this is rough.
Thank you.
Thank you.
All right. With that, it is 12:02 and we're adjourned. Thank you, everyone.
Thank you.